Hi, everybody. If you're listening to this, you probably know that this podcast is not medical advice. You should also know that in this episode, we talk about adult reproductive functions. We talk about it in a mostly medical way, but if you're listening in your office or at work or with kids around, it might be one that you put on your headphones for.
Hi, everybody. I'm Jackson Vane.
I'm Johnny Kolasinski. You might remember me from such podcasts as Too Much Goo, a review of men's hairstyles in the 90s. And Jackson's hot tub cleaning experience earlier this afternoon. Oh, wait, that needs more explanation. It was just...
No, that sounded horrible.
It was just the guy came to service it. That's not better.
No,
anyway.
No, that was way worse. It was a lot of brown goo.
Anyway, this is Hi Everybody, a Bad Medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works. With us this week, we have frequent guest, Dr. Greg Winter.
What's up, everyone?
And
oh, wait, I'm sorry. Hi, everybody.
It's the name of the show. There's two rules. Don't touch the table and say the name of the show.
I got back there.
And new to the show, Dr. Nisha Shah.
Hi, everybody. I am, as my husband likes to say, I like to ingratiate myself to everybody, so I want to make this perfect for you.
Bad news, I'm the one editing it, and it won't be.
Nope, definitely not.
Greg is a palliative care doctor, as we've spoken of before. What is your specialty?
I am I originally trained in pediatrics, but I specialized in allergy and immunology, so I also see adults and kids, and I hope to add a new perspective for you guys.
You can find this podcast online at hieverybodymd.com and on Facebook, Instagram, and Twitter at hieverybodymd.
Yep, and you can also reach us via our hotline at 850-DOCTORB.
The B is for bling, as in Hotline Bling.
Oh, God. So I already cringed twice in this episode. It's horrible. So, and it's kind of fitting that Nisha's here for this episode, because we are actually talking about another House episode this week, and It's called Safe.
Yep, episode 16 of season 2.
Yep.
I'm curious, how are you guys picking your episodes of House? Just because they all have to do with, what's making you focus on one versus any other?
Because she's here.
Yeah.
Fair.
I
guess you were just saying that and I interrupted.
Yeah.
It's not coincidental that we picked this one.
No, it is not coincidental at all. The main reason why is it's about this teenage girl who was a recent heart transplant recipient.
Michelle Trachtenberg from Buffy.
Yep. Or Pete and Pete or Harriet the Spy, whatever way you remember.
Eurotrip.
Yes. That's actually a good one.
It's a great movie.
That is actually a really good one. Future episode, maybe.
Scotty doesn't know.
We can just watch it.
Yeah.
We don't have to talk about everything we
Is this
watch.
how did this get made now? But she recently got a heart transplant. They kept her in a clean room, but her teenage boyfriend comes in and sneaks in to meet her, and then she goes and gets anaphylactic.
Yeah, which is the tie-in. Overall thoughts on the episode as a piece of TV?
I love House. It's hard to not like it. It's been a long time since I watched it. We were kind of reminiscing about how probably it helped us all, in some respects, get through med school and just the insane testing that is associated with it. But it's also
horrendous.
It's really bad. It's like entertainingly bad. It's just like,
I think
not everything that can go wrong keeps going wrong.
I think you said it best. He is so confident and so wrong so often.
Until the last 6 minutes of the episode.
Where he violates someone.
He's as rude to everyone when he's right as when he is wrong. And since the episode doesn't... this is every episode of House. It only resolves in the last 10 minutes. So that means there is 44 minutes of him just being wrong.
Yeah. Pure nonsense. And also just... I got through medical school watching this show. And I'm pretty sure I watched this particular episode, and I definitely have a different perspective now. But
is this what inspired you to become an allergy and immunologist?
I would love to say yes, but
different perspective as a
I'm going to go with the
allergist.
no. But the one thing House gets right is that when you're in training, when you're learning, he loves his differential diagnosis, and he puts it all up on that board. Lupus. And he goes through why everyone around him is wrong about what they're thinking. And everybody is saying the completely wrong thing because that's how it's scripted. But this episode definitely is right up my alley for sure.
Yeah. Now, from those of us in the room who are me, differential
yes.
Differential diagnosis.
A differential diagnosis is basically when you're learning about how to diagnose something with what is wrong with them, you have to come up with alternate theories. So you're basically coming up with like your 4 best theories about what you think is wrong with someone or right or whatever you think is happening in this particular situation medically. And so we call it a differential. So anytime you write a note about someone or you talk about a patient, you have to say, number 1, this is what I think is going on, but if I'm wrong, which is highly likely, there are 3 other options, which are probably true. It's basically like your typical multiple choice test question.
Well, it's like when a patient is coming in, you don't have all the information. They're presenting in a certain way. You get as much as you can. You start doing tests, and it's like, based on the information we have now, we think it's this. It could also be this or this or this.
Or E-lupus.
Or also in a house episode.
It's always lupus. So. Yeah. Always.
Or schistosoma.
Oh god.
I didn't see. I wasn't watching when I first came in, and so I didn't see the beginning of the episode and how the differential broke down. But I'm wondering, like, if you just watched a house episode back to back, like twice in a row, is it the first thing that he says is right all the time, or is
Never.
it
No.
Never.
Okay.
No, not even that last.
No, because the first thing he said in this one was the S thing that I didn't know.
Some kind of
So I'm scrolling to later.
Is that Sjogren's?
Yeah, Sjogren's.
He started with Sjogren's? No.
He said something that sounded like it, but I was saying no, it wasn't that. He said something, but I want to
aneurysm.
some aneurysm, which didn't make any sense. But
can we go back a little?
I want to go way back.
Okay.
So actually, before the anaphylactic shock, Michelle Trachtenberg. This character had a name, and I apologize, but she's Michelle Trachtenberg and Michelle Trachtenberg's boyfriend. Mm-hmm. The boyfriend sneezed when he looks at bright lights. Apparently, that's a thing that people do. Is that just a thing that people do, or could that have been indicative of something?
It's a thing that people do.
Yeah.
Okay.
I'm sure that it has a
But
name.
it was his excuse to continue to see his girlfriend because the girlfriend's mother is a hypochondriac / crazy mother of a person
His daughter did just have a heart
who
transplant.
had a heart transplant. So he was like, no, I'm not sick. He's trying to convince his girlfriend's mother that he's not sick. So he's going to say whatever he can say to be like, to explain away his sneeze.
Yeah.
And that is, the light always makes me sneeze. No big deal. I can totally continue to make out and have sex with your daughter. So that is...
As long as he keeps the mask on, which is the rules.
I've never seen anyone fuddle around with an EpiPen as bad as that guy.
Yeah.
It's like him... I wonder what's like with condoms for that guy. Like,
well, he doesn't wear them. We learned that later in the episode.
Yeah, that's true.
Can I just say, I feel like most people, if they've never seen an EpiPen or an epinephrine auto-injector, which
Nice.
Jackson mentioned,
Quality.
if you're in that stressful situation where you think someone's having an attack and they're dying, you're supposed to be the hero. It is very difficult if you've never been trained or shown how to use one.
Can I follow up with one thing? Why did the mom stab her in the knee then?
So when I was doing after-school camps, I was trained with a fake plastic EpiPen.
Good.
And fake epi'd my roommates all the
Excellent.
freaking time.
I will say, we used to play with those fake auto injectors, the trainers. Like, my fellowship, we had a whole box of them, so we would take off the safety so that we could pretend to fence each other, and if we stabbed each other and it went off, that's how we know we won. Because we're quality ER doctors.
You gotta fill the time somehow. You're
Yeah,
at the
it
hospital
gets real boring. You just get those fake trainers and just try to stab each other.
Did you eventually move on to
The real thing?
dueling with I don't know, tongue depressors?
That's basic
That's a step up or
Okay.
step
Really?
down.
Did that really? What? I went through an entire fellowship in allergy immunology and I never got to use my EpiPen.
No, it was like the fake trainer. The
Anybody's
trainers?
fake
Trainer.
Oh, I thought real one.
I'm not
A little
legitimate.
confused there, dude. I was like, oh,
You know, those
that's
How come everyone in this fellowship
hardcore.
has such a fast heart
Like,
rate?
that is hardcore, Jackson. I was like, whoa.
like pneumothoraces.
Oh my god. Okay. Yes, trainers, of
Yeah.
course. Okay.
I don't know. I kind of like. Yeah, I like your rules.
assumed way more than I should have.
Yeah.
We all know Jackson.
You're 50-50
I have a
on-
question. So the only times that I have seen anaphylaxis is depicted in a movie like this. So Jackson is in the ER. You probably have seen some actual anaphylaxis.
Yeah, for sure.
And Nisha is an allergist and immunologist. So how does this stack up to what you actually see in real life when she's when she was going through that?
So normally,
first attack?
I don't see them that fresh all the time. Though I will see them come into the ER newly exposed to something. So usually their face is pretty puffy. But EMS, if they came in by ambulance, should have given them something already at that point. But usually they're complaining of wheezing, they're throwing up a bunch, their lips or their tongue is super swollen. They can't hold on to their stuff, that kind of thing.
So the first anaphylactic scene we saw, I think the order that we saw it go through was she was itching as he came in.
Yeah.
And then there were visible hives.
Yep.
And then this is something you both noticed that wouldn't be accurate necessarily, was she got super active thrashing around as she was. I think
sometimes people panic because they can't breathe. But that's what I'm asking. You're re-asking
they
that
kind of have.
Yeah,
they kind of
just going through the list of.
I will say they will have the bug out eyes, where it looks like they can't breathe and their eyes just kind of bulge out of their head, but they're not thrashing around. At least from what I've seen, they're usually just trying to breathe more than anything. I don't know what Nisha sees in her clinic.
I will say that. So to answer Greg's question, so we.
Thank you.
So, as an allergist, immunologist, we actually in our clinic we sort of inadvertently induce anaphylaxis sometimes because we are doing things to patients to desensitize them to things that they are allergic to. So part of my job existing in clinic is to be there to treat anaphylaxis because sometimes we may be desensitizing someone to something they're allergic to, so we're giving them shots, little amounts of what they're allergic to, and so sometimes we might see them at the very initial points of anaphylaxis, which could be something as simple as itchy palms, itchy feet, like they might feel a little weird, like
sounds hot.
A sense of impending doom, which is what they ask people for, and we will definitely get back to that, Greg. I definitely want to go back to that. But to answer Greg's question, no, sometimes you basically have to just see what the patient's doing, and like if they're not acting like themselves, confused, not talking, completely just out of it, yes, you're going to be like, we gave you something that you're potentially allergic to, which I have the benefit of knowing, which Jackson may not.
Nope.
And then, yes, of course, we will definitely treat as we're supposed to with epinephrine, and we will have it ready. It's a very controlled situation. Whereas with Jackson, being an emergency medicine physician, may not have any clue what could be coming into his
These are
ER.
such full sentences.
And
I love it.
so often, ER doctors think things are allergic reactions when they're not.
How dare you?
Which we see all the time. The ER doctor told me I had an allergic reaction to something. And we're like, no, maybe not. So
my defense would be, I don't know what's going on when you come in and you're not breathing. If you have hives or you have two systems involved, in our head, we go anaphylaxis. Yeah. We break out. We actually, in our department, we actually just use EpiPens. We don't measure them out anymore because it's a lot easier and a lot faster to get.
Jackson's job is to keep you alive. Yeah. And if Jackson says, okay, you're here, I think you're having an allergic reaction, I'm going to treat you that way. My job is to keep you alive. I don't need to know anything about your backstory. That is not important to me.
If you made it to Nisha's clinic from my ER, I did my job.
Exactly. So Greg, my answer to that question is very different from what you may see in an episode of House, but my opinion will be, I will be judging you.
Yeah, we will be judging Jack. Oh, how did this guy think it was an allergic reaction?
What the hell? No. But yes. So the fact that a patient made it to my clinic is Jackson did his job.
Fair enough.
Right? Patient is alive. They made it to see me, and we are gonna figure this out.
Yeah.
And if in the process I may say you don't need to be here, then that's great because you're still alive.
I will say I make very few referrals to allergy immunology.
Exactly.
That's not the next step after the ER.
It's very rare. I usually say go see a regular doctor who will make a referral to see someone.
Maybe we'll talk about this later, but I'm curious because of what you do in the clinic, like. The airway management in this episode is very poor.
Oh, yes.
Do you guys
what's reverse?
Are you ready to intubate? Are you like, what do you have ready if you're potentially inducing an anaphylactic reaction in somebody?
In most cases of known anaphylaxis, you don't need to intubate because you're catching it before there's any airway involvement. You know what's happening. You perceive the patient's going to tell you they're itchy and like you're going to treat it right away. So we don't. To answer your question, we don't have crash carts. We're not an ER. But yes, we have to call 911 just like everybody else.
I will say
which rarely happens.
I never
if
call
ever.
911. Not ever.
But you're a hospice doctor.
Right.
But we rarely intubate people with... It's hard to intubate someone who has anaphylaxis because their airway is all swollen.
That's right.
So you have to use a very small tube if you need to do it, and it's tough. Don't you do it.
So...
Also, it's very hard to ventilate somebody whose like airways are like spasming and contracted, right, Jackson? Like you can't get the air in. Like you definitely don't want to intubate those patients. But to answer your question, Greg, like you're right. You definitely want to get people like Jackson involved early. People who know how to handle very emergent situations where you need to treat breathing issues and things like that. So anytime you're in a doctor's office, you're not in an emergency room. You need to be able to call 911, access it, be next to a hospital like we are. Like you definitely need to like transfer that patient to somebody who can handle that with oxygen, intubate them, put them in a setting where they can be treated. Which is why when you get allergy shots or you're in an allergy clinic getting desensitized, you have to be very close to a place where you can get treatment like that. That's why you don't get those things at home. So,
can I just go home and do my allergy desensitization?
So, supposedly, the allergic reaction happened when Michelle Trachtenberg was in a clean room. It was her bedroom, but they had access restrictions. So, people came in wearing masks, there were no open windows, they presumably wiped things down. There was a lot of stuff there. Would it really be considered a clean room? Would you call it a clean room?
It's clean to her,
Yeah.
because it's all her stuff. So technically, it can be considered a clean room.
Okay.
But, it's TV.
Yeah, that's right. It's more dramatic because it's real hard to be a boyfriend that climbs in the window of a hospital as opposed to somebody's bedroom. But
it's clean to her.
But you can do anything if you believe in yourself.
Right.
In the hospital, when they have those clean setups, they have negative pressure doors so that things can't even blow in the room. The problem is in the hospital, there's a ton of sick people around. So if you are immunocompromised, it may be a better idea to if you can have a setup like she has, it may be better for you to not be in an actual hospital.
Or if you're in an actual hospital and it happens to be Princeton General or whatever.
Princeton Placeboro.
Princeton Placeboro. Your doctors and family can all come in wearing gowns, but no mask and no gloves.
That's the most important part. It's the gowns, the $5 gowns.
So I know what Johnny's alluding to. So when we were watching this, I was just criticizing the fact that they were in gowns, but no gloves and no masks. And I thought, if this is a contact isolation room in the hospital, should they be wearing gloves and gowns? But I think, yes, to agree with Jackson, the fact that the mother made a clean room for her daughter in the home is probably true, meaning the fact that her immune system is used to everything that's in her room. But the fact that she was letting this random dude come in and see her, who she has no idea where he's been, what he's touched, what he's been around, and
that's
exposing her.
All teenage boys.
Exactly, is not a clean room. He is contaminating her room, as any boyfriend of a teenage daughter would be. But in my immunologist's opinion,
that's not all he's contaminated.
Her immune system would not have reacted so quickly to him. I mean, he was only there for like a few seconds in the scene, but unbeknownst to us, he had been there frequently. So she could have built up a, possible tolerance to her boyfriend, but her immune system is not normal.
I have to be honest. Yeah. A possible tolerance to me was all I generally went for in relationships.
Yeah, exactly. Thank you.
Maybe.
That is what my mother would hope for.
It seems like you have a possible tolerance. Maybe we could go out for lunch or something.
I feel like that is what I would ask for future.
I think I don't know if they touch on this because I walked into it late, but you don't just have an allergy from something. You have to be exposed to something before you have an allergy, right? I think that's what this whole episode is kind of centering on, is that she has a delayed reaction, and so no one can understand it from the timeline.
And they talk through a few things that it could have been. One of which either you or Courtney, who was watching with us, jumped out immediately. They brought up perfume, and that perfume generally would not be.
Yes, so inhaling perfume or being around perfume or smelling it or touching it would not induce anaphylaxis. Really?
I mean, it's
yes.
I'm learning right now. I don't mind. I just, because that's something that can set off asthma.
So it can set off asthma, but you would not get a full-blown IgE-mediated immune response that would induce anaphylaxis because you're just smelling perfume. You're not getting exposed to like a full-blown allergic molecule. Like that's not going to happen. But if you have an underlying state of respiratory like issues or asthma, yeah, it might make you wheeze or something like that, but it's not going to be the full-blown explanation for her intense allergic reaction that she has in the scene.
Is this like mast cell release and all that and histamine stuff, or is this different?
Yeah, mast cell release, histamine, like the whole full-blown like...
Jackson and Nisha both did much better than me on all of their STEP exams, so I'm re-remembering the things I learned before.
I studied theater.
Interleukins, all the stuff, all the leukotrienes.
I'm going to sit here and just go, these are really big words.
These people listening to us right now don't care about these big words I'm spewing out.
You'd be surprised.
This is nerdier than usual.
Yeah, this got real technical.
I'm so nerdy, and Courtney told me, she was like, don't nerd out.
Don't nerd out.
Don't nerd out.
Do nerd out.
I mean, the extent of our usual podcast is there needs to be more blood.
Actually, from Knives Out. I'm sorry to bring it back to Knives Out, but yes. So much blood.
Another allergy. This one is something that I had no idea existed. You brought up allergy to exercise.
There is a diagnosis called exercise-induced anaphylaxis. You can look it up. Not to be confused with exercise-induced asthma, which is also called EIA. So you can have... There's people who exercise.
Wait, there's exercise-induced asthma and anaphylaxis?
Yes.
And they chose asthma to be the abbreviated one?
Yes, they did. EIA, I know.
That's discriminatory towards anaphylaxis.
I think it's something that they should not abbreviate either one. It's going to be
exercise-induced anaphylaxis is a disease where you basically go into some sort of cardio exercise, and then while you're exercising, you go into anaphylaxis, meaning you have a severe allergic reaction. Your lips swell up, you can't breathe, your throat starts to close up, and most often it is within 4 hours of eating something. It doesn't have to be anything in particular, but often it is something you might be slightly allergic to. Oh. But within 4 hours of eating something, you exercise, and then you have anaphylaxis. If you exercise outside of that 4-hour period, you're fine. It is called exercise-induced anaphylaxis. So my thought while we were watching this House episode was she exercising before she did this?
I thought you mentioned that it was mostly teenage guys.
It is, yes. Actually, yes, Johnny. Yes, you're right. So mostly when you do see these patients, they are teenage males, teenagers, who do this, and then once they hit their 30s, 40s, they don't get it anymore. But yes, and we tell them to not exercise alone and to warm up before they exercise, which helps them, and not eat within 4 hours of exercising. But yes, it is mostly adolescent males that get this.
Is it just because once we hit 30s and 40s, we pretty much stop exercising?
Pretty much, maybe. I don't know. That is the statistic. I will have to get back to you on that, because I can't for sure say
now,
why.
Is there, like... What's the physiological reason that exercise is what's inducing this? Do we know? Is it like the amped up heart rate combined with the potential allergens that they've eaten, or?
Great question. So no one really knows. We think it's because when you exercise, like you rev up some sort of inflammatory process. The same reason why I mentioned when some people have exercise-induced asthma. So like a lot of people suffer from this. Probably people listening to this podcast. Like
Dr. Winter does.
Yes, right. So you start
working
out. You start working out, and you get to a certain heart rate. You get pumped up. You're getting into your cardio, and then you start wheezing. You start coughing. You can't get through your workout. So the same mechanism that gets you to this threshold of working out is the same thing that happens when you exercise and have anaphylaxis. But it's like a very severe threshold that you have to meet. But we don't know why. But one of the things we've figured out is that if you've eaten within 4 hours of exercising, so there's something that has to do with something with the food you ate. So I can get into this in more detail if this was not just a fun podcast about movies and shows. But
you can take anything and make it
anyway.
Fun. Yeah.
So what Dr. Winter is suffering from is sort of related. But yes, we don't know why, to answer your question, Johnny. But if you warm up and don't eat and you're starving and you exercise, you're probably going to be fine, but maybe not. I don't know. Let's just move on.
My favorite thing that's ever happened on the show just happened, which was for the first time someone talked over the jokes to be more informative. And I appreciate that so much.
You're welcome, Johnny.
The joke was a good joke. I don't care.
Have you not met me before? Like, this is what I do. This is what I've done with Greg for years.
We were dying.
Years.
While you were trying to be like very informative and helpful, I made a stupid old
I heard them all, but I ignored them.
I'm impressed.
You've had a lot of good...
I have had a lot of
so
practice.
Much training at ignoring the things
so much
that I'm saying.
practice, John. This is years of just dealing with...
I'm going to make the most awkward non sequitur ever.
Yeah, dude.
Or transition ever, rather. And, no, but we're getting there.
Sorry.
But another thing that we
I
brought
apologize.
up, and this one came up in the episode as a possible allergen, is semen. By the way, parents, if you're listening with your kids, you should have stopped it about 10 seconds ago.
The beginning of this episode?
Is semen allergy. I learned today that that's a thing.
So yes, semen allergy is a thing, and it surprisingly is very popular whenever I go to conferences, allergy conferences. But yes,
Semen allergies get the butts in seats.
yes, there's always a poster. So if you ever go to a medical conference, there's posters where people present their research and present what they found. And
splattering of posters?
Yes, a splattering of posters.
I would never ask you to steal me a poster from a conference.
But,
however...
Does UV light
In
help
fact,
pop
there
out?
was a conference I went to where the poster across from me was about a semen allergy. But yes, it is true. You can be allergic to your partner's semen. Most often it is a repeated partner. So someone who you've slept with multiple times.
it'd have to be.
Right. So when you're allergic to something, you have to be exposed multiple times to the same protein. And semen is full of protein. And so often this is something you can encounter. It's very rare, but when it does happen, you need to see an allergist and you get desensitized to that semen. So there are people who have gone to allergists who are having sex with a committed partner and they want to continue to have sex with that partner without having allergic reactions, so they get desensitized to that semen.
You have to do semen desensitization?
Yes, that is a thing.
My God.
That
I'm
is
so
a thing.
happy I got to say that.
That is a thing. I know. I was waiting for someone to say that.
Question. How do you desensitize someone to semen?
So in my practice, I've never done it. I've only read it theoretically in journal articles and seen it at conferences. But it is done pretty much in the same way that you desensitize to anything else. So you have very small diluted exposures to the thing that you're allergic to. So you would probably dilute the semen and expose your patient in small amounts over a period of time.
Just like
until they can tolerate it.
Sperm ingestion.
Yes, exactly.
You mentioned that it's a specific partner. So you can be allergic to one person's sperm or one blood type worth of, that's just me making up something because I'm not a doctor.
What's the smallest unit of something you can be allergic to? Is it like a protein or is it a...
So yes. So in general,
I'm
it
sorry,
is a
you're representing all allergists.
No,
right
sorry.
now.
No, it is in general a protein. So, but yes, you can be allergic to certain chains of carbohydrates, which is very rare. But it's almost always some sort of secondary or tertiary structure of a protein that you can be allergic to because it's an antibody seeing a structure of a protein. But yes. So yes.
And so
to answer your question, Greg, yes, exactly. Okay. But your partner will have a very specific type of protein or carbohydrate that's encasing that sperm or whatever you're trying to desensitize them to. And so, yes.
So it is you could just be one person.
I miss you so much.
It's not, you're going to have a general sperm allergy to sperm. It's going to be
to a specific
potentially
to a specific.
That's how you know you found the one.
Yes,
is you're willing to go.
No, that's how you know you have not found the one.
Sorry. So if you are a person who is able to form an allergy to one specific type of sperm, you will most likely form an allergy to another type of sperm. So you are 100% an allergic person to begin with, and then you form an allergy to that type of protein. So you may have one partner, which most of the time when we diagnose a sperm allergy, which is very rare to begin with, it will be to somebody who's married or has a committed partner. And then they may find that they want to have children with that partner, and then they need to be desensitized to that sperm in order to bear children or whatever, or to continue to have sex with that person without dying of anaphylaxis.
Which is always a goal.
Which is always a great goal, right? So then one would hope if they left that partner, their next partner would be fine initially. They more than likely would probably develop an allergy to that other sperm and then have to decide if it's worth it to get desensitized to that sperm if they're going to continue to get exposed. If they will not get exposed to that sperm for the foreseeable future, then it's okay. So, I mean, to answer your question, yes, it is. You're most likely somebody who's going to form an allergy, and then on repeated exposure, have to deal with that.
How good are you? Like when you do desensitization, like what's your success rate? Are you always able to desensitize?
Most situation, yes,
okay.
yes.
How long does it take to do it?
It depends on the situation and the drug or whatever you're desensitizing to, but most of the time you have to be like admitted to a hospital, probably an ICU setting, because you're monitoring for pretty severe allergic reactions and you're giving them small doses. But depending on the type of reaction, you can do it in an office if it's not that severe, and you can bring them back every other day. So certain antibiotics, we do it where we bring them in every few days and we desensitize them. Sometimes we have to admit them to the hospital. It's all patient dependent, Greg. It's all patient dependent.
This sounds like a fun office visit.
Yeah, that's fun.
I'm just imagining the breakup conversation. It's not you. It's my anaphylactic response.
Everybody loves the sperm discussion.
It's fantastic.
When I was in fellowship, they're like, you know what? You're gonna love this, but this conference, you're going to love the sperm discussion. It's going to be a thing. It's going to be a thing.
I don't know what this episode's going to be titled yet, but it's going to be revolving around that allergy.
Yeah. But we're not even talking about the episode we're talking about. Jackson.
My last question, and then we'll move on. Is it a scratch test?
Would that be a scratch test?
Would you do a scratch test to determine that that's the allergen?
So the problem with scratch testing is, yes. So yes, that's ideally you would want to scratch test, but you have to. There's a point at which when you scratch someone with someone that they may or may not be allergic to, there is an irritant reaction. Mm-hmm. So you have to scratch multiple normal people who you're not considering to be allergic to get a baseline.
Now this sounds like a fun office.
To get a baseline, because if not normal people react to it, then it's an irritant reaction. But if your patient reacts to it, then it might be an allergic reaction.
Sounds like a real sticky situation.
You got it. Yes, very sticky. So anytime
Nisha,
you have to baseline a normal, right? So
normies.
yes. So you always have to have a baseline test. So,
and I'm guessing you generally can't find five
people
to sign the form.
Maybe you have medical students. No. So, but basically, when you test somebody, you have to test them with what you think they might be allergic to. What is a definite positive allergic reaction, which is usually histamine. You scratch them with histamine, which everyone reacts to.
That's weird.
And then you scratch them. You scratch them with saline, something very inert or something they shouldn't react to. So if that person reacts to the sperm, then yes, they might be allergic to, or they might be irritated by whatever's in it. So then you have to decide whether it's the sperm or something else. Most people, if you're allergic, you're going to make a reaction to that. So that's but you're basing that test not because you think they might be allergic to it, but because the patient's telling you, whenever I have sex, I have an allergic reaction.
So this is follow-up to what Johnny's asking. It's okay, so you have somebody that's suspecting, I have an allergic reaction to my partner. How, I guess you don't do that. You don't know is what it sounds like, but what are the next steps? Are you getting their sperm and, centrifuging it and then what? I have no idea. You're nodding your head yes.
Yes, I am nodding my head yes. So, yes. Greg, wow. Very smart answer.
I'm educated.
Oh my gosh, yes. So you're absolutely right, Greg. So they're probably centrifuging the sperm, isolating just sperm and maybe some other whatever peripheral proteins you might have in there. And they're trying to figure out, are you allergic to the sperm or allergic to something else that your partner is contributing? Because most often these situations are people trying to conceive or trying to have a healthy sexual relationship with their partner, and they're trying to figure out what is it about their partner that is contributing to it, because it's either that or just use a condom. Because if you use a condom, then you're probably not getting exposed to whatever you're allergic to.
But I have a latex allergy.
Okay, that's a whole other podcast. But so most often,
most
often these referrals are because people are trying to conceive or trying to not use something that is protecting them from their partner's sperm. So yes, that part of the process is trying to figure out what they're allergic to, which would involve like centrifuging it out. So yes, very good question.
When you're doing scratch tests and like in my head, when I think of what you're doing in your clinic, I'm like, oh, she's like laying out a grid on somebody's back and scratching people with a bunch of stuff to see what they're allergic to. Does that have any credence at all, or
Yeah, so the stuff that we're scratching people to in the clinic has already been predetermined to be of non-irritating concentrations to most humans. So, like, most of the stuff is standardized. It's been shown to, like, not induce, like raised red lesions on people who are not allergic. Like, it's stuff that if you react to it, you're allergic. If you're not allergic. So it's been standardized, meaning, like, they've tested on a bunch of people, and they're like, this is not irritating. It's gentle. If you're allergic, you're going to have a reaction. If you're not, you're not.
What's the most common allergen?
I mean, it depends on where you are. But yes, like
mole,
animals, probably, and grasses, pollens, mostly. It depends where you live. If you live somewhere dry like California, molds are very rare. But if you live where I did fellowship in New Orleans, molds are very common. So, I mean, it just depends.
I'll stop putting you on the spot. I'm sorry. I'm just curious.
No, I like to educate.
When I talk to Jackson, he never tells me anything worthwhile. So.
What?
No,
I find that shocking.
I got nothing.
I've taught Jackson everything he knows.
That's why.
Also,
that's shocking. Very good.
As a family medicine doctor, if you have a latex allergy, which is a possible thing, you should still use protection when you have sex. You should always use protection unless you're in a committed relationship.
That's when the star goes across the
That's
screen.
the more you know thing.
Yeah.
That's the one moment of medical advice
that I will get
in this episode.
There are other things on the episode that kind of made me, at least from an ER perspective, that kind of got me was when she was in the MRI machine and they were trying to do more tests on her and she had a breathing tube in her throat.
Yeah.
And they just yanked it out.
Yeah, that was the thing I had the most problem with in this episode, is that they had very poor airway control.
Yes.
In an emergency situation, it goes ABC, airway, breathing, circulation. You have to maintain someone's airway. And she has a maintained airway. She has an ET tube in, right?
Yep.
So that's a tube that is an established airway. Even if the throat gets swollen up, it can't crush the tube, but they just pull it out, which is the worst thing you could possibly
usually
do.
There's a balloon there, too. So they just yanked it out
the balloon. Where's the balloon?
The balloon is below your vocal cords.
Whoa. Okay, see, I thought when you talked about the balloon, I thought you were talking about, like, the bag that they would use to
You mean the bag that accepts the blood coming from the chest tube that we talked about in the blacklist?
In the blacklist, yeah. The same thing, only with air.
Yeah.
And, used correctly.
But, yeah.
I didn't realize that when you talked about balloon, it was something below your vocal cord.
I may have missed it, but, I mean, when I was watching that scene, I did not see them deflate it. So usually...
No, he just pulled it.
Usually you have to, like, deflate, so move the air out of that balloon so you can easily pass it through and move it out, but it seems like they just yanked it.
And she was fully awake during the entire MRI kind of procedure, and usually if they're intubated like that, you want to sedate them because
if they move around.
Yeah.
Imagine if you have something literally in your airway, like, it's irritating.
Yeah.
Even if even if you're aware of what's going on and you know that you need it in there, it's still too irritating for you to calmly sit there.
It's like something stuck in your throat constantly.
I'm not a doctor, but I have vocal cords and I'm really uncomfortable right now.
Yeah.
By this whole concept.
And here's the thing: you can't talk with the tube down your throat because your vocal cords can't move.
Which is why House, did the pull start on the.
I mean, he did he tried to start that lawnmower, but. If you're gonna do that, you want 2 knees on the chest before you pull.
Yeah.
Oh,
really
good advice.
No, but it's like he pulls out the tube to potentially communicate with her, but she's not able to say anything the entire time. I mean, she wouldn't be able to because her cords would be damaged, but also she's too out of it, even in the show, to respond. I mean, she's basically coming in and out of consciousness. It's just that was the part that was really frustrating. Like, no matter what other discussion that you have a person who is pretty stable and you have an established airway. You would not remove that so that then you can argue about what to do next.
So then you can argue about what to do next and ask if they'd had sex more than once.
And then the follow-up was, in between questioning, they would put the mask on her face and then, give her breaths. That's really uncomfortable. Like, you're basically blowing air into your stomach, into your lungs. It's like someone if you stood in front of a mega fan and just blowing air into your face, you can't talk.
It's like a dog with its head out the window.
Yeah.
Everything is getting that air. It's not just the lungs. But when you have the ET tube in, you are making sure it's just going into it's like you have the perfect setup, and then to basically create a countdown timer, you're like, screw this, I'm pulling this tube out. Now we have an emergency.
House knew that there were only 7 minutes left in the episode.
Yeah, that's true.
And so the countdown timer was already established.
Just to clarify, ET tube means endotracheal tube, so the tube is going through the trachea, past multiple passageways into the lungs, so you know that the air that you're blowing in is going to the lungs, as opposed to other orifices.
Because it was just named after the movie because it was long on his neck.
Yes,
correct.
And they had that scene with the bicycle and the moon, so
yeah. Absolutely.
It's the same joke. Why are you all looking at me like I'm crazy?
It's also to fit Reese's Pieces down her throat.
See, third time's a charm.
Yeah,
screw you.
That's how it works.
It got weird.
But I guess the final diagnosis they came upon was tick paralysis.
Yeah,
which House found by essentially violating someone.
Stopping an elevator.
I
mean, so when did that? That was probably 2005 when this episode came. I'm just taking a stab. I have no idea. Could you have this episode now?
I mean, I'm not a doctor.
2006.
And I'm also but I read things, and that's become a big thing.
Yeah, I mean, I'm not doing any exam that
involves
big
that
thing
stuff
in the
without
media, multiple chaperones. I'll have the nurse and sometimes a parent in there just to make sure my bases are covered.
Right.
Because they can say one thing and you're done. Mm-hmm. So anytime any kind of exam like that happens, there's multiple people in the room. And I know it's really uncomfortable for whoever gets the exam, male or female. I have to protect myself. So that is a common thing that happens.
Yeah, consent matters in medicine. It's a weird thing. If your life is on the line, people are allowed to kind of do their job and try to protect you try to protect your life ultimately however they can. But also, you are going to have a witness in there to make sure that you didn't do anything weird. Probably more than one witness in there, especially if you are same sex or opposite sex, whatever. No, probably just multiple witnesses, no matter what at this point.
So in a normal non-house situation, he would have been right to make that examination to look for the tick, not right to do it right for that examination to happen.
No,
needs consent.
The patient needs to agree, or whoever. I mean, if she's a minor, then the patient's representative needs to agree. But it's like you can't do stuff to a person without their consent. That's assault. Even if you are a doctor, you have there is a legal part of that you have.
What if it was a life or death?
So that changes things.
That's what I mean. That's what I'm saying. He was in the right in that it was a life or death situation potentially, not in the right because he stopped an elevator to do it.
Right. Yeah, he's in the wrong because he created that situation.
Well, yeah.
But if he didn't find the tick,
yeah, that would have been really. I mean, that's.
We don't know.
Don't touch someone unless.
It's a tough situation in that episode because we don't know if it's life or death. the other doctor was like, this patient needs to go to the ICU, and they were on their way to the ICU. It was just one elevator ride, and then he paused the elevator to prove himself right, which I don't think would ever be appropriate. Like, if you have a designated place that you're supposed to be transporting your patient, you have to stabilize that patient until the point you get to your destination, which was not done in this episode. Like, in my opinion.
No, they did.
Like,
she was stable, and then they created
they created a situation where she wasn't, and I don't know. I mean,
no one should be using the elevator stop button.
It's crazy. Like, that whole episode.
You know those aren't even connected, right?
I mean, I don't know.
All it does
not
is
an
make the
elevator
Velcro
repair
ring
podcast, not an elevator maintenance podcast, but when we do one, because I think it's come up before.
It was self-created. It wasn't like the elevator malfunction. Did the elevator malfunction in the episode, or was it a self-stop?
It was a self-stop.
Okay.
Yeah. It was a full house stop.
Yeah.
I just wonder if that's an episode where you, like, that's clearly played as a joke.
Yes,
where, look at how, like, he's doing the right, like,
yeah.
He's finding it and he's solving the situation, but it's like, I don't even think that episode makes it on air anymore. Like, you don't get to spend time
rooting around down there.
Nether regions without their consent.
I'm going to take it back, for one more question,
not the question.
Not the question.
These house episodes are 22 minutes?
Yeah. No,
they're 48. Yeah, we're
minutes.
already longer than the episode. We'll keep going. So they talked about, as a diagnostic tool, injecting a rat with her blood to find out if she had botulism or something. You're giving me the same look that I had.
There's a way easier way to check botulism. You look at their poop. That is the easiest way to do it.
Please explain further, because I don't know what you're
talking about. So that is actually how you check for the antigen for botulism, is you go through their stool.
Oh, you're not looking at it, you're taking the stool sample and doing stuff. Okay.
Yeah. The answer is...
like, you just look at their poop?
Yeah, I look at it and I'm like,
it's purple.
Botulism.
But does it taste like botulism?
Tangy. But that's actually how you're supposed to check, is you're checking through their stool, not taking someone's blood and then injecting it into a rat.
Is that something that would ever be done ever?
I've never ordered a blood test to be injected into a rat.
Hospitals don't have rats.
Have you considered it?
I mean, hold on.
Are you thinking of it now?
Some hospitals have rats, just not in the testing capacity you think of.
They just share your food.
Correct. But I've never ordered that before.
That sort of, so that was kind of the second differential diagnosis. So every house episode starts with the cold open where patient is doing something and then they pass out and have a seizure. They always have a seizure. Then they end up in house's hospital, and they like kind of give you a little bit of the background, what you just saw, and then they run through everything. Lupus is always on there. And then later in the episode, after they've done some tests, they do the secondary differential where it's like, we've eliminated this and blah, blah, blah. And that's the point when I was like, oh, that's right. This is learning med school. Like, that is what the testing is like. That is why we all have watched the show and enjoy it, because you remember these stupid, like, oh, that was on that episode of House. This happened and this happened. Yeah. So it was like, oh, I remember why I like this show. And then immediately as they start saying things like, oh, yeah, you got to inject her into a rat and maybe she has botulism. And it's like, this has no application to actual clinical medicine. Like, it's wonderful and entertaining to watch, and then it immediately becomes just, like, nonsense.
With that, unless we've got more to add, I have a question. Nisha, you are probably familiar with this question from having listened, but...
Question mark.
Question mark. If you've made it this far into our episodes. But the human centipede bills itself as 100% medically accurate. If that's the case, how medically accurate is Season 2, Episode 16 of House MD safe?
Are you asking any of us in any particular...
I'm going to ask you first, because you spoke up first.
I should have said nothing. What I should have said was nothing. I'm going to say that it's about 70% accurate.
To the human centipede.
Oh, no, not to the human centipede.
Yeah, compared to... If the human centipede is 100%...
What did I say? No. That's never how I've taken that question. Because the human centipede is not 100%.
If that's the case.
But if that's the case, then this is 580% accurate.
It's always in comparison to the human centipede.
I mean, if human centipede says it's 100,
right?
We're gonna
that's why Home Alone was 140.
But that's not what okay. You know what? I need to listen to that episode.
I don't remember much from that episode.
Podcast juice.
I never laughed harder editing something than I did our Home Alone episode.
Me neither. That was so informative.
All right. So Greg says 580-ish.
Yeah, I think they do a really good job depicting what an anaphylactic emergency may look like, which has been confirmed by people that actually sort of seen them. I have never seen them. But yeah, it seems like that's fair. And then the general idea of medicine that happens in a hospital is sort of depicted in the way that House depicts it, in the sense that doctors do talk about things.
Wait.
Doctors have conversations.
We're supposed to talk about things?
Wow.
No.
I mean, that's the best I can... That's my biggest problem is all of a sudden... They're like saying, do these tests, do this. Those tests take days and days to come back with... It's like, you have to do the thing where the patient doesn't die first. Yeah. Like, that's number one. And in House, that gets lost so quickly because even though they stop the patient.
Because it's more important. Well,
it's those damn rats.
But it's more important in House to know that you're right than to save the patient.
I mean, it's certainly more important for Dr. Gregory House to know that he's right.
I thought you were going to go a different path there. Dr. Gregory Winter.
I'm always wrong. I'm fine with it.
300%.
300%.
Yeah.
That is the highest number that Jackson has given. I think that...
It's true, though. It is pretty accurate in certain things. The ethics being wrong doesn't take away from the medical accuracy.
That often makes it more medically accurate.
But yeah, it's pretty accurate. I will say that. Like the tick paralysis stuff, it's a little weird, but...
I mean, it's just a real shaky diagnosis to begin with, but they explained it. It's fine. I believe it.
Trex-plained is a good term.
Yes.
That's our new t-shirt.
I'm fine with it.
Yeah.
So I don't think we got into the final diagnosis of this episode, but
we just went straight to...
Yeah, I feel like he just mentioned it, but...
This is not an insect podcast.
Yes, I know. But I maybe 100% because this is one of my first episodes.
So you want to have room to grow.
Yeah, I just feel like...
What you're saying is it says medically accurate.
Yeah, as I would expect it to be.
No.
Oh, as
the human centipede.
Okay.
Yeah, the human centipede is our baseline.
But I feel like...
Have you seen the human centipede?
No, I haven't, so I have nothing to compare it to. So I should not be talking right now.
Looks like we're going to be doing Human Centipede 2 Lost in New York.
However, I do feel like what I witnessed today in this episode was mostly medically accurate for what they were trying to portray. However, I feel like the intent of what they were trying to portray was very inaccurate. Like their interpretation of what was happening, like what they were showing was probably what you should do, but the way they were responding to what was happening was inaccurate because none of that would ever have happened in the time space that the episode took place, which is every House episode. And honestly, like the patient did well in the end, which probably would have been the outcome anyway, despite anything they did, which is exactly what we hope to have in medicine, is that like whatever we do should do no harm, which I would say yes, most like they met all that criteria for me.
They did so much harm.
No, I don't think they did.
Wow, that was the longest roundabout to
I don't think they
just
did.
as accurate as a human centipede.
They saved her. She was in the hospital, and that's where I left it.
If you let a tick suck long enough, it will either unlatch itself or it will explode. And
that tick would have left her.
And had she had an ET tube in and been supported from her airway and circulation otherwise, she would have been just fine.
Secondary question, how would we make this episode more medically accurate while keeping the stakes high? Or wouldn't we?
I mean, a lot of the stakes remained high. House doing inappropriate stuff definitely kept the stakes high. Stopping the elevator, sexually violating a teenage girl, stakes were high.
The stakes are very high. I think they... So in medicine in general, especially in a hospital and especially in a teaching institution, there is a clear hierarchy. There is there's a lot of discussion that happens that patients and families do not see, but by the time people come into a room, there is one person that is talking, and there is no arguing about it with the other people on your team.
That is something that's never come up, like, in this podcast so far.
I sort of said it before, but I wasn't as articulate.
Podcast juice. Podcast juice.
But yeah, you're right. It's a thing that I'm thinking about.
To that extent, yeah.
Yeah, and I mean that is the entertainment of House, is these super smart people arguing with each other. But really, if you're in any of these situations where a patient's vital signs are going down, like they're crashing, that's what's like literally this would be a code situation. If someone's blood pressure is going down, their heart rate's going down, you aren't trying to. You're doing less trying to figure out why that's happening and more trying to make sure that stops happening. And that's a thing that is never addressed in House because they always solve it like, oh, we got the worms out of your brain and now you're not seizing anymore. Like, first we're going to stop your seizure. That's what we're going to do first.
And then worms.
Then we deal with the worms.
Yeah.
Sorry, is this not the worm episode?
No, it's not the worm episode.
I want the worm episode.
There's a worm episode?
I think there's anaphylaxis in that, too.
That's a future episode.
Are we going to, do a double feature with that in Futurama?
I'm not a one-trick pony. Like, I can do other episodes. Like, it's
no, you can only be involved for...
You're
I'm only on for hospice episodes.
Like Home Alone.
Exactly.
2 bumbling thieves.
2 bumbling thieves. 3 bumbling doctors. All right. With that, thank you, everybody, for being a part of this. We'll be back next week with more Hi, Everybody, a Bad Medicine podcast.
Yes.
Yes.